Hello, everyone, and welcome to this audio podcast. This audio podcast is part of a Nephrin molecular series or edition. This audio podcast is part of the Tornado PlexAR. This audio podcast is part of a Monster Bostics, and this audio podcast as part of a Storm Robotics production. In this audio podcast, as part of this audio podcast series, a little bit in around some works in some works around the social media platform, the RPSG, or the Renal Patient Support Group. So the RPSG has been a sort of a voluntary social media platform which was and has been sort of a sort of a has been service user sort of a service user led initiative and established originally in 2009, and established in 2009 sorry by 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 sort of the co-founders from the southwest part of England, United Kingdom. The RPSG is thus a service user based and service user service user sort of led. And so, unlike other sort of social media platforms, the RPSG is also, or has also been, sort of a research a research sort of has had so has also had a research sort of aspect. So the RPSG platform allows its members to actively seek out initial information, and has been sort of a sort of a place where both sort of service users service users where service users, for example, are sort of carers or guardians, and patients can become more empowered. The RPSG continues to expand and has invited researchers, investigators, and healthcare professionals to gain opportunities provided by the platform to improve the health or healthcare for patients by facilitating and getting involved in real discussions. The RPSG network has thus been utilized to help inform and transform practices by enabling patients and carers and healthcare professionals to share understanding. There are also sort of published works highlighting how using or utilizing online methodologies and modalities to collect data, and as a resource for communication can be advantageous. So whilst the RPSG does not provide patients with a sort of clinical or medical advice per se, it does provide sort of semi clinical context, and this sort of informs of sharing sort of experiences through discussion threads on the platform. In addition, the RPSG has had sort of helpful links, the latest links, websites, and group pages, and guidelines and standards relating or regarding to nephrology and renal care. Number two, guidelines, frameworks, and research papers. Number three, a research folder consisting of surveys and supporting data collection projects, where followers or service users can investigate and explore different different sets of projects, voluntary opportunities or activities, a list of what have been referred to, at least in the United Kingdom, as kidney patient associations or KPAs, and related groups or regarding groups and sort of pages, and also sort of photographs are in around various sort of activities, photographs of varying activities, again where within the social media platform there are where photos are there are they are the photographs are entered into albums, where these albums are only accessible by those within the social media platform, and also where the identifiable information has remained confidential since the sort of underpinnings of the RPSG. So thus to maintain the privacy and confidentiality of the service users in amongst the RPSG. Also, summaries around particular sort of discussions, flyers and posters, are sort of on behalf of research investigators, etc., and summary of data collection from projects projects and collaborations, and also where sort of where at the time when this paper was published in 2014, the RPSG also had a blog page, which can be accessed for example non RPSG users, the RPSG blog is now accessible and accessible through sort of a main RPSG and sort of KDAR's sort of website. So specifically, the RPSG has supported service users and healthcare professionals, albeit perhaps not, perhaps healthcare professionals not so directly, but appreciate where there's appreciation of the larger the broader concerns for patients or service users relating to CKD, and sort of many other important aspects in regard to the condition, and so following the RPSG example, several additional social media platforms and groups have emerged or had emerged, including the Kidney Disease and Renal Support Group, or KDAR, the KDAR's group for kids, and also varying others, for example, parents and guardians to become more sort of active or proactive, and thus empowering themselves to take a lead on providing sort of the more support in around sort of where where evidenced works can be utilized as part of as part of where young people attend or have to attend sort of clinical or medical appointments, for example. So now a little bit into a little bit in around the kidney disease and renal support group, or KDARS group, for kids or young people with varying forms of chronic kidney disease, which will where in around KDARS will be as part of a subsequent audio podcast. That draws this audio podcast to a close. This audio podcast as part of a Nephrin molecular series or edition. This audio podcast is part of a Tornado PlexAR. This audio podcast is part of a Monster Bostics, and this audio podcast as part of a Storm Robotics production.